third, fourth, and sixth cranial nerves are examined together as they work conjointly and supply the extraocular muscles involved in keeping the visual axis of both the eyes parallel in all position of gaze except convergence. Sit at same level of subject. Ask the subject to keep the head still and then to look at your right index finger held at 50 cm distance. In primary position of gaze, look for visible nystagmus, squint, and ask for diplopia present or absent. Now move the finger right lateral rectus of the left eye and medial rectus of the right eye being tested. Now move the finger up. Superior rectus of the left eye and inferior oblique of the right eye being tested. Now move the finger down. Inferior rectus of the left eye and superior oblique of the right eye is being tested. Now move your finger to the left side, noting the smooth pursuit movement. Again, move your finger up and down in a similar fashion to test the muscles as of the opposite side. Ask for diplopia at any stage of movement to detect any paresis of extraocular muscles. The name of this test is conjoint eye movement and ocular alignment. Now test for light reflex. Ask the subject to look at infinity and note the shape, size and symmetry of the pupil. Now to test the direct light reflex, ask the subject to fixate in the distance and in a dim lit room, shine a bright light from the temporal side into one eye and look for constriction of the ipsilateral pupil. For indirect or consensual reflex, ask the subject to keep the palm over bridge of nose and observe the contralateral pupil when light is shown in ipsilateral pupil. Repeat in other side. Three tests for third, fourth and sixth cranial nerve are tests for conjugate movement of eyeballs, light reflex and accommodation reflex, which we will perform now. Ask the subject to look into distance and then to your finger held at a distance of 20 cm from subject's face. Look for constriction of pupil and convergence of the eyeball. Anterior bulging of lens which occurs, however, cannot be seen. Another method is advancing your finger towards the subject's face and looking for constriction and adduction gradually, and then ask to look into distance again.